and welcome to Askimo TV. We're talking today to Martin Samuel. Martin is a speech and language therapist specializing in adult acquired and degenerative neurological conditions, and as well as working with teenage and adult stutterers. Hi Martin, how are you?
I'm very well. Morning, Joanne.
Hi Martin. Today we're going to be having a discussion about swallowing disorders. So probably the best place to start is, what is a swallowing disorder and what is the medical name for it?
Right, okay, so a swallowing disorder is really any difficulty managing food, drink or saliva in the mouth, throat or the esophagus, and its medical name is dysphagia.
Explain what happens in people who have this disorder.
Well, people with dysphagia, they have difficulty managing food, drink and saliva safely. So there can be social effects of swallowing, so because people are embarrassed about the difficulty that they have. There are also risks of aspiration, which is when food, drink or saliva may go down into the lungs instead of the stomach, and it can cause chest infections. Choking is also a risk of swallowing disorders, so it really requires careful assessment and management and treatment.
What are the potential complications of a swallowing disorder?
Okay, so first of all, swallowing disorders can be congenital, so they can be from birth, or they can be acquired later on in life. The causes of dysphagia are varied. They can be caused by structural difficulties, say with the tongue, with the mouth or the throat or the esophagus. They can be caused by traumatic events such as strokes or head injury or oral cancer, and they can also be associated with a range of medical conditions such as multiple sclerosis, motor neuron disease, Parkinson's disease and progressive nuclear palsy, as well as, say, with dementia. There are also a large number of people with learning disabilities who also have swallowing difficulties.
What are the causes of swallowing disorders?
So, I thought the next question was, do swallowing disorders only affect adults?
Do swallowing disorders only affect adults?
Okay. Swallowing disorder can affect people at any age, from the very young to the very old. Generally, there are different speech and language therapists and medical practitioners who will treat people at different ages that the disorder occurs at.
What are the causes of swallowing disorders and what are the symptoms?
Okay, so some of the causes of swallowing difficulty can be things like strokes, head injuries, structural abnormalities, and sometimes they can actually be caused just by people maybe say following kind of oral cancer where they've had part of the tongue removed. And generally the kind of signs and symptoms would be somebody may have a series of chest infections, somebody may be coughing or throat clearing when they're eating and drinking, such as going or more severely they can have choking episodes as well, which is obviously very, very severe, and we need to do all that we can to prevent that.
How is a swallowing disorder diagnosed?
Diagnosis of swallowing disorders is essentially done by several steps. So the first step would be taking a patient's case history. Then we'd want to carry out an assessment of what we call their oral motor function. This is where we look at how the muscles and the nerves involved in swallowing, eating and drinking function. So we're really looking at the rate, range, speed, control and sensation. Then we really want to analyse the patient with a range of food and drink textures to see how they can manage these in their everyday situation. Then for some patients, they may need a additional instrumental assessments, such as we can take a video x-ray of the swallow, or we can put a camera into the mouth and the esophagus and see what happens there.
Who evaluates and treats swallowing disorders?
So in the United Kingdom, where I practice, speech and language therapists are primarily responsible for assessing and treating swallowing disorders, though we do liaise with colleagues when appropriate, such as, say, with dietitians if the patient is very underweight, or especially, say, with gastroenterologists if the swallowing disorder is more to do with the esophagus rather than in the mouth or in the throat. In terms of treating swallowing disorders, there are essentially 3 different ways. First of all, we can try and rehabilitate the swallow using exercises. That is not always possible. Secondly, we can have some behavioural or some postural changes, so maybe slowing down the pace of eating, swallowing more on the side which is less affected. And thirdly, there can be food and drink modification. In reality, it is normally a combination of all of the above approaches for most patients.
Thank you, Martin. Thank you so much for talking to me today.
That's okay. You're welcome. Thank you.